How you going, team? This is Dave Neal from the Eighth Mile Consulting, and today I'm fortunate enough to be talking with Kellie Stecher, who's an obstetrician over in the US. And Kellie and I crossed paths, under that banner of good people helping good people, and we got talking, and we found a lot of alignment in our values, and some distinctions in our beliefs, which is really really cool. We've had some good chats about a whole variety of different topics, but the purpose of today's chat is bringing Kellie in to discuss a new initiative that she has taken the lead for. Insofar that, if we look back in our context, until recently, we had a big surge of medical support and need within our communities. And there was a whole suite of people that were putting in the hard yards to keep many people alive, many people safe, and they were doing a lot of things behind the scenes that were going unnoticed. And Kellie saw a need to recognize those particular actions and behaviors. And so she launched a concept called the Patient Care Heroes. And we're fortunate to have Kellie in the flesh today to be able to describe what that is for us. And so, Kellie, could you maybe explain a little bit behind the concept, and we'll take it from there?
Well, thanks for having me. So when I was looking at basically what's gone on over the last year in terms of the pandemic and how we've handled it in the US, I realized that we're really missing resources for our medical community. And I think that this need has been there all along. We just haven't taken care of it,
Mm.
especially in the form of mental health and burnout. And so when you look at the studies and the data and the research that's been going on pre pandemic, we saw this tidal wave of burned out physicians that were struggling with balancing work life, that were struggling with administrative things, with the healthcare system that exists. And so we had much more in the way of physicians and nurses leaving the field of medicine. And of course, this all contributes to depression and anxiety and so on and so forth. So when the pandemic hit, we already kind of had this underlying issue, which of course was exasperated by the increased stress and the sadness and the grief that a lot of people felt. And so we are seeing that in the way of significant mental health issues across the US in physicians and nurses in our medical community. And so my biggest goal right now, or I should say my most urgent goal with this, is to make sure that we have barrier free access to mental health resources for our medical community. Because unfortunately, physicians have the highest rate of suicide of any profession out there. And this is not helping matters. And so I want to make sure that we're able to take care of the people that take care of us.
Yeah, it's you're absolutely onto something here, because let's be honest, before I pressed the big red button to say record on this, we were talking about you currently having done back to back, night after night shifts. And right now we're talking at the back end of one of those shifts. And coming from a military background myself, I know the demand that that has on the body and the mind. And any half intelligent person will admit that you can't be in a state of surge forever. If you do, adrenaline and cortisol will take its effects on your body eventually, and you're going to feel the burn. And so, from my perspective too, I have a great deal of respect for people that attribute their lives to service and very rarely ask for anything in return. I have a huge amount of respect for people like that, and they largely go unnoticed for that exact reason. And so, from your observations, how would you say, for all the physicians and the medical staff out there, or the people that subscribe to your initiative, what message would you say it with regards to burnout, or with regards to mental health or resilience or sustainability?
I think that you really need to find what you're passionate about. And honestly, I have never felt burned out in terms of patient care, right? And so I have no problem working and working hard for patient care because that's what I'm passionate about, right? And in terms of my initiatives and different things that I'm involved in, that never has seemed like work because it feels like my passion in life to try to help people through it, right? And so I think that if each of us can find what really lights us up, that's really going to help our mental health overall. And then, unfortunately, so many people in healthcare almost see it as a weakness to stop working, to kind of stop and smell the roses, right? And so we also see it as a weakness to seek mental health resources if we're struggling, or to be on medication, things like that, because there's such a stigma still. And I know that nationally, state by state, there's different regulations in terms of licensures for nursing and physicians, and also for our different boards and societies and everything like that. And we have so many people who are fearful of pursuing mental health care. And so, really, I just want to make sure that they know that we're fighting for them. We're going to advocate for them. We're going to work on national changes in terms of legislation that will protect people. And we want them to seek the help that they need.
Yeah, good. Okay. And so, from I guess from an operational standpoint, from the program that you're running, how would someone subscribe to your services, or what would be the best way in which they could reach out and engage with your team?
Yeah, so we're on a lot of different social media sites, but patientcareheroes.com is our main site. And right now, I've discovered, talking to people nationally, that there's a ton of resources out there that no one really knows exist, even foundations for scholarships that people aren't aware of. And so, really, what we're trying to do is also highlight those, make people aware of them, to get the people who need them the help that they need. Right. And so that's one of the goals as well. And we've worked with a lot of different advocacy groups in terms of mental health, and they're going to be on board with this to help connect up providers with people who need them. And I'm really excited about the opportunity we have to really utilize the resources we have, and then hopefully from there move forward to create a much more diverse and all encompassing type of resource for mental health.
Yeah, yeah. So that's a really important point, because from our previous discussions, you were talking about it being kind of like a hub, insofar that it was a place where people can redirect. It's almost like a bit like a train station. You come to the train station, you read your screen, you figure out where you got to go and by when, and then you can start redirecting to the resources and capabilities that'll help you get what you need.
Absolutely. And, we really wanted it to be a community where people felt safe and having an exchange of ideas. And one of the reasons that I thought of this initiative in the first place is I really felt like we were not humanizing the people that were taking care of all of those who were sick with COVID. And again, this is not a new issue. We have people who unfortunately are killed by patients. We have people who are abused by patients. And so, really, we want a community where people feel valued and appreciated. And with that, we are also going to memorialize the people who have died. And that's going to be a growing, changing thing now and forever. But we want to make sure that families feel appreciated as well, like their loved one's story does not go untold. And so we're going to be having a site where people can upload videos, where people can blog, where people can ask what they need. And then aside from that, we're going to be raising money for grants and different things. So maybe we can support kids going to different camps, right? Because so many families are struggling. Even if both parents are alive and well, if both are working, still kids don't go to camp, right? And so if you are a healthcare provider and your child wants to go to some expensive summer camp, we're going to have an ability where you can apply for that money.
Yeah, that's amazing. It was Brigadier Appleton in my military context that once said, he had been on multiple deployments. He had done a lot of extensive deployments, and he said, it was hard doing those deployments. But then when he fathered a son, that son was my best friend, Chris Appleton Jr., and I'm sure he'll watch this. But I remember him distinctly saying that it was significantly harder to be the recipient, as in the father of someone who's deployed. And Chris Appleton Jr. and I deployed to Afghanistan and fought there. And I remember the passion in what he was saying, and the sincerity in his voice when he said, this was so much harder to have your son go do this than to go do it yourself. And that really speaks to the issue in a more holistic fashion, doesn't it? Because, if someone in a family works in a career under in service, whatever that service is, the whole family really takes a piece of that. And they all in some way absorb some of the friction. I mean, using examples of shift workers, they have to go do weird and wacky hours. That stress gets in, of time trying to deal with kids or family or whatever it is, gets imparted. You can't get all those things sorted during business hours. I totally get it. I've lived and breathed this stuff. So that's a really important point, to be able to provide resources for the family. There's another part that cued my interest when you were talking, Kellie, and it reminded me of something one of my sergeants once said to me. And I was a bit young and immature once, believe it or not. And I was burning myself out big time. And we were doing very, extensive exercises and those sorts of things. And anyone in the military will be nodding their head or shaking it, depending on what their perspective is here. But a young officer trying to do the right thing, not trying to drop the ball, but doing like 3 or 4 days straight awake. And my sergeant ended up walking up to me and said, like, go to bed. And for all intents and purposes, if it matters at all, that technically outrank him, but in experience he outranked me. And he was like, if you go down, you're no good to anyone. And so that would be a message that I would pass, a personal message to people who work in service areas within the community, is that if you go down, you are no good to anyone. So, you really do need to think about sustainment. You really do need to think about how you can do this in an enduring or long-term fashion. And resources like the one you're suggesting, Kellie, play a big part in being able to do that. And then the other part is this is you're not Superman or Superwoman. All right. You are something in between. Okay. It's like the old proper heroes don't wear capes. Well, it's a little bit like that. You actually genuinely need to think about the long-term plan in this so that you can leave a legacy of service. But if you go down, you become a liability. And so I'd put that spin on it. Really leave your pride and ego at the door and really go and get the support you need so that you can be in for the long game. One man's opinion.
No, I mean, it's absolutely true. And, you know, I think that culture of medicine really plays a lot with burnout and, the mental health issues that we see. And we just need to kind of fight through the stigma to get us to the other side.
Yeah. Yeah. No, I think you're doing amazing work. And, you know, we've got a saying in the eighth mile is act the way you want to be remembered. And that speaks to legacy. And you can't hide from that. And what you're doing right now, I have no doubt will leave an incredible legacy in years to come. And what I would like, to see happen in the future is that in 20 years' time, they go, of course, this program was created. It makes perfect sense that it was created. But unfortunately for people like yourself, Kellie, you've got to wear the burden and until that happens. Someone's actually got to build the thing. So look, from me to you, thank you very much for the service you're providing. I think it's admirable. I have a lot of respect for you and the team, and I'll continue to advocate at my level. And I hope all our listeners do the same. But, and it's probably well-deserved sleep coming your way so that you can start looking up for yourself as well. Is there anything you'd like to say, Kellie, as a message to people before we go our separate ways?
Really just have grace with each other and try to treat people how you want to be treated, right? I mean, the golden rule. I think we've lost a lot of empathy, especially in the States, and we need to really take a look at how we treat each other. And that's really going to be the key to us moving forward in any capacity, solving any issue that we have, including healthcare equity. And hopefully we can band together and move forward.
Yeah, an amazing way to finish this conversation. Thanks so much, Kellie. I really appreciate your time and I wish you Godspeed.
Thank you.
All right, cheers.